Hello everyone, this is your host Rohan Tandel from Inno Health Magazine Studio. I welcome you to this podcast produced by Innovation Queries with a mission to spread awareness and knowledge of various facets of healthcare innovation. You are listening to the Voices of Inno Health podcast from Inno Health Magazine, the first magazine in India on healthcare innovations. In this podcast, we invite industry leaders and discuss their views on the healthcare industry and innovations. Today, we are going to have a conversation with Dr. Shirshendu Mukherjee. Welcome, Dr. Shirshendu, to our podcast. How are you today, sir?
Good morning, Rohan. I think and Sanjay, I'm fine, and we are all passing through a very challenging phase in our lives. I think a lot of us have seen such type of pandemic arising globally for the first time, and a lot of us kept. I think 90% of us have seen, and this is a challenging time for all of us in every sphere of life. So, but it is a great learning also in many ways. So, yes, it's okay going on.
So, before starting with the podcast, I would like you to tell us a little bit about your career path, your journey up to this point, sir.
And thank you, Rohan. I think it's my journey has been a very interesting journey with lots of ups and downs in the career path and the life. So, but I come from a very small place in Madhya Pradesh called Jabalpur, and I'm born in a family of doctors. My father, my brother are both one of the father leading was a leading physician, and my brother is practicing there. So I come, and my mother is a very around social worker. So I think I come from a family of doctors. And then I basically did I'm a microbiologist by training to specialize in medical microbiology, and started my career from a very large pharma company. Was lucky and blessed to start a career with a erstwhile large pharma company called Ranbaxy. But I began my career from the lowest level in the ladder. I was a shift microbiologist there when I started my career. Slowly, after completing my PhD, I was made the research scientist. I moved the ladder to become research scientist in JK Drugs and Pharmaceuticals, then to Becton Dickinson for the immunology business. And then I shifted my basically gears to come from a core wet science work, which was working on antibiotic research, immunology, wet science work. I moved on to science administration and science management. That was a very interesting shift on my in my career path. And I joined an internationally reputed organization called ICGEB, the International Center for Genetic Engineering and Biotechnology, which was initially established and catalyzed establishing by UNIDO, and now globally this has three centers: one in India, one in Trieste, which is also the headquarter in Italy, and one in Cape Town in South Africa. So I was basically a research management officer, or research scientist, handling intellectual property law, technology transfer, innovations, helping the organization to write grant applications, to raise funding, to do the public relations work, to file IP, manage technology transfer assignments, and any other issues on public relations. So it was a very interesting shift. And ICGB is one of the very renowned places which has a high competence of very strong, high level, globally recognized scientific manpower, which works on human health, agriculture, plant biotechnology, and various other programs they have, plus trainings, PhD programs. So it was a very interesting shift. A lot of my mentorship happened there, and I moved along the path. I was there for almost 7 to 8 years, and then moved to a global charity based out of London called the Wellcome Trust. And I was there for some time in London, and I moved back to India to head their R&D for affordable healthcare in India. And there my experience in funding research program started way back in 2008, where I was involved in managing the R&D for affordable healthcare, which was a unique, innovative program which funds innovation or translational research, as we call it, or the development research, taking programs from literally bench to bedside or lab to market, you can say, which was a very, and identifying, hunting new innovations, taking those new innovations from literally from a proof of concept to market valuation. So I think that was a really I handled around initially the corpus was of 30 million pound sterlings, and then we funded almost 30 to 35 projects and got a very good rich a remit of products coming out from that innovative funding, which was from medical devices to drug discovery to vaccine research to diagnostics to mHealth. It's a very wide portfolio of funding we work. And then from there, I was there corely on the Welcome's program till 2016. And then I moved on from Welcome and I was fortunate to work along with DBT in my Welcome initiative and moved to the Grand Challenges India program with the Wellcome Trust, Department of Biotechnology, BIRAC, which has been established in innovation enabler in India, and the Melinda Gates Foundation to work with the Grand Challenges India program, along with the leadership in BIRAC and DBT. So that was a shift I did, and now it is I'm presently continuing in that position. But it's a very interesting and challenging role, which really helps me to work on the various challenges going around in the country, from maternal and child health to infectious diseases to agriculture, nutrition to medical technologies and devices to data management, artificial intelligence, antimicrobial resistance. So it is a very, very about almost 20 plus program, and also policy. So I think this is, so we are funding, managing, enabling along with the team, and being housed within the BIRAC ecosystem really helps us to expose you to the BIRAC's broader ecosystem in India. So it is really, really very, very interesting path. And right now, since last 2 years, we have been working on COVID management as well. So interesting to work along with my colleagues in the National Biopharma Mission, in the COVID Suraksha, in BIRAC, in Grand Challenges, in Department of Biotechnology, to really, enable COVID innovations. We started with working initially in late March, April 2020 for how to prevent COVID, like supporting sanitizers, the PPE kits, thermal scanners, ventilators. We started with that, slowly moved to diagnostics. Now we are aggressively working on vaccines. So I think this is what our country needs, and supporting the innovation in that place, in academia, in industry, in startups, has been a really interesting learnings and supporting science. Though in these challenging times, I am myself a COVID survivor, so it has been a very challenging time for all of us in the ecosystem. So this is what my journey is all about me. But yes, there has been a great learning. There have been days with challenging problems, but I remember a line of Swami Vivekananda in one of his works: that day you do not come across with a problem, take it for granted you are trotting on the wrong path. So I think problems are to come, and we have to really find solution to these problems, not and then move ahead. So I think this has been a learning. Over to you, Rohan.
That was a great journey, sir. That was elaborate, and kind of the experience that you shared was quite enriching for many of the followers that would be willing to follow. So now further talking about
one
careers.
thing I would like to tell Rohan, also I am a lawyer. So during my ICGEB days, I was permitted to do my LLB also. So I did my LLB from so that really helped me. So I'm in my career path. Just to add is that apart from PhD, I did my law while working. So that really supported my academic enrichment in legal field. Also, I was fortunate to do study at IIM Calcutta to strategic management for my programs. And then 2 years back, I was asked by the Gates Foundation to go for an international course on public health by London School of Hygiene and Tropical Medicine to do a public health course as well. So I think fully exposed, and also I was a student at Said Business School. So that really helped me to really have a 360-degree exposure to my learnings as well. So I think that is very essential. When you learn these type of courses, not only you teach you what are the principles behind it, but the colleagues which are there, with whom you are studying, really enriches, because experience learning is very, very important. Sorry, I just barged in between, but I thought I should add that.
Yeah, so that's a wide range of profile that you worked on at various levels of hierarchy through various organizations. So I guess that that would also be an inspirational journey for many of the upcoming people in the similar industry, I guess. So now, further talking about careers, we utilize resources available to us to pave our way ahead and grow. So my question to you is, would you like to share some of the resources or books that you found enriching in general or focused on healthcare?
I think learning never stops. If I can show you my library, which is on the right side of it, it is still. I can briefly show you. This is my library, and I don't know whether you see. It is still a huge collection of books I have, and I literally, read every day, every night without reading. So I think that I can't pinpoint any books. I'm a microbiologist, so my core expertise and things is microbiology, which I'm still in touch with. I read a lot about microbiology, antimicrobial resistance, new innovative programs, how to manage innovations, how to fund startups, what are challenges in startups, how innovation can be exploited to the next level. So there are a number of things which is there all, and learning is not only through books, but talking to my colleagues, my juniors, my seniors, my mentors, and then possible probable funders. You learn a lot. So learning has to be a two-way. You can't think that you read a book or something like that, or you're exposed to some course, you learn everything. No, learning has to be, just like a clinical course. My father used to say, that a clinical study like MBBS, BDS, or BMS, or whatever clinical program you study, you just can't read books and study unless and you see maximum number of patients. You don't you don't have the right experience and that light learning in the clinical field. Similarly for us as well, which is innovations is a everyday, very, very dynamic and evolving thing. Every day something new comes up, something new. You can very well take the examples of vaccines as well. We started with one strain, but then alpha strain, beta strain, gamma strain, delta strain. Now we are talking of pan strain vaccine. So, it has been a learning, and our scientific community, the innovators community, has to be very, very aware, open to read. And we have good tools these days to learn. Like we have a very, very enabled internet ecosystem. We have our colleagues, peers, there are a lot of webinars going on. So learning has to be a continuous process. You can't say that you have did the course and you learned everything. So I don't feel that way. I learn everything from my surroundings as well. And that is very, very essential. So learning should not stop. It should learn. And there are no particular resource. In our field, we fund innovations in a variety of areas. So if I say that I am good at microbiology and I will not study, read about biomedical devices, so that doesn't make sense. You have to read. I don't want myself to be my hardcore engineer to know it, but at least how this is an enabling tool to do a particular study or test, we should be aware of it. Similarly, I'm not a clinician per se, but then what a clinician face challenges, we can understand and relish that by talking and discussing with people. So I think it has to be a 360-degree approach to learning, with not a particular resource, but an open eyes, ears to hear and to listen and to discuss. And learning should not be just concentrated to you. When you learn something, try to disseminate that to your colleagues, your friends, and your society per se. So that they will have some, they might critique, and then you learn further from it. So criticism is an important form of learning as well, I am feel. So I think that needs to be really be progressed well, and we need to do it continuously. And see, I studied, as I told you, I was interested in IP law. So I thought doing LLB will be, at that time, the evening courses were there and things like that. So I started learning when I was almost 35 or 36 years of age. So I did my LLB. It was a very aggressive. You have to work from 9 to 6, then you have to run to attend the classes, and then you have to give exams. So it's a challenging time, but it is a great learning doing LLB course, understand nitty-gritties of law, because we do a lot of technology transfer. So we do a lot of contracts. We do a lot of IP management. We do a lot of sometimes we receive notices, and that's what, if you I'm not a lawyer per se in practicing sense. I'm not a lawyer per se in practicing, or registered lawyer or something, but at least I can, if something legal comes to me, I can really make out of it what sort of interpretation it needs to be done, and then my legal colleagues support it, who are day in and day out of the law. So I think similarly, when I went to IIM Calcutta to study strategy, in our field, we need to have strategy and a dynamic strategic management system. You can't have a strategy and then review it after 2 years. No, it has to be dynamic and iterative. So that's what helped me to learn there as well. So then, and then leadership was very critical in how to be a leader. How I think that learning is important, and understanding public. So I think keep it very dynamic and keep learning. Try to interact with people, and that has to continue really very, very efficiently.
That's a great perspective, sir. Learning doesn't only comes from the courses or say books that we come along, but rather it's the most of the learning comes from the experience that we gain through our career path.
Yes, you're right.
So now moving ahead, talking about career and experience, we all get our inspiration, the drive to perform from some source through our careers. So my question to you is, what inspires you in your work? And individuals you idolize and why?
See, if you see my individuals who idolize, there have been many people who have really helped me to shape my career. Starting from my PhD guide, who was there, late Professor G.P. Agrawal. I think he was the first person who taught me how to be a human being. That is very, very important in life. You have to be a human being first. He taught me one very important thing, which I still use in my life. Whenever you take a decision on somebody, keep yourself in that position first, and take a decision. We have to take decisions a lot of times for our team members or our colleagues. So keep yourself in that position first and take decisions. You will never be wrong in your life. So I think it started from him as well. And then my bosses in my career paths, whosoever had been boss in various companies which I worked, I have learned something or the other from them, everybody. An ICGEB, Professor V.S. Chauhan, who was the director at that time, he taught me how to be, how to take critical elements forward, how to break the challenges and so sort of solve the problems which you face in life. And that was a very critical path in my life when I was in ICGB. When then I moved to the Wellcome Trust, the head of Wellcome Trust, Ted Bianco, really helped me, to basically to take get a global perspective and how to move things globally out from an innovation in the bench. That was a very critical element in my life when I moved to Wellcome Trust. And then in the Gates Foundation, my colleagues on like Dr. Steve Buxbaum, who was the deputy director of Discovery, he really helped me to look at challenging perspectives. And then two other people who have made me very, very critical in my life is Professor M.K. Bhan, who was the Secretary DBT and the first chairperson of BIRAC, and Dr. Renu Sarup, the present chairperson of BIRAC and the Secretary of DBT. They played a critical in my career development and mentorship. They provided me very strong mentorship in multitasking, understanding the problem, how to be methodical, how to take decisions, how to be transparent in life. That is very, very important. Be transparent, be open, be systematic, and I think that is very, very critical. If you are transparent, you are open, you are not biased, you have to take a decision. It might be a very critical decision against your, because in the community or the friend or something, you have to take a right decision. I think these I learned multitasking of works. I learned from Dr. Swaroop and Dr. Subhan as well, who really mentored us. And then it is not only these few names I took, but there are a lot of people who were involved, my colleagues in my team. I learned from them a lot, and that's then my friends, my who advised me a lot of times, a lot of things. So I think I think I named a couple of people who really played element of development in my life, but I think there are many more people. It is not possible to name all of them, but they really help to. But you should have role model and mentors in your life you should evaluate, you should learn, and move ahead. So they are important because they have seen more world than you, they have taken more decisions than you, they are more averse to, they must have faced more challenges than you. So they really give your experience from those challenges, and that's very, very important to learn from them. Be methodical, be honest, be transparent. And that's apart from science. Science is keep on, it is a very dynamic field, you learn around. But I think these people really helped, they are the people. So I named a few, but there are many, many more people who have really played an important role in my career development.
So now coming to the next question, talking about innovation, the definition of innovation may be same for everyone, but the meaning, the value of the word differs from person to person. So my question to you is, what does healthcare innovation mean to you?
So innovation, as you rightly said, what is innovation? Let us really break it. Innovate is something which is coming out as a new, or which has not been available earlier. Innovation comes out from that. So it comes from the word ignite also, which comes out something new. You ignite that, something new comes out. It can be incremental innovation. It can be a new innovations. There are a lot of incremental innovations. I can give them the examples which were the product was known, but something incremental added to it really improved the efficiency of the product. So that is also a very, very important step in innovation. So as you know, innovation is not just over one step job. It has various ways. If you innovate in a test tube, you need to validate in a big flask, then a reactor, and then take it to the market. So if you're a device innovator, you make an alpha prototype, you test it, you make a iterated, make a beta prototype. So it is a step. So innovation is a cycle which really moves from really your table, bench, laptop, or wherever you are, to the bedside or to the field or to the market, wherever it is. So though it is a very, very short word, but it has n number of challenges into it. And the challenges are starting from raising funds, to building a team, to getting infrastructure in place, to these days we have incubators, but you have to get into incubator, then do the validation, then again raise funds and do the validation, and then productize it and take it to a level. So it is a a cycle which is there, and each step needs to be taken. Any innovator should not see that, oh, I started the innovation, tomorrow I have to have a product. No, I think it has to be a stepwise process where I think that really is what innovation needs to be done, especially in respect to healthcare. The innovations which we look at is, and anybody should look at it, is when the innovator starts working on innovation, is firstly how affordable it is. Or firstly, you should know how accessible is it, or how user friendly it is, has to be looked at. That is very, very important. Healthcare is a very important program in our country, where 1.35 billion people are there. It has to reach. So how accessible it is. If you make a very high funda innovation, which is there only at a very, very selected, that innovation may or may not impact. So impact to the quality of life and improvement healthcare has a very, very relevance in a healthcare innovation. So how accessible it is, then how affordable it is. It is very important part in accessible, and affordability is very important. And this is are the two basic facts where the innovator has to look at it, and we look at it from that angle as well. So firstly, it has to be innovative. It should not be duplicating work that yeah aap kar rahe ho usko humne repeat kar diya and make it so affordability is important. So it has to be innovative, it has to be affordable, it has to be accessible. So that are key elements of innovation cycle, which I think everybody of us should follow.
Sir, you rightly pointed out that innovation is not just bringing new technology and getting things done, but it's also about accessibility and affordability, because the main reason of innovation is to address to the needs that are being arising in the market. And if it's not accessible or say affordable, then it would be limited in terms of demographic that it is reaching. So it would negate the point of that innovation. So I would affirm with the point that you brought up. So now further talking about innovation, we observe trends both positive and negative through various industries in this duration of pandemic. So I would like to know, how did the COVID pandemic change your perspective on healthcare, especially when it comes to innovation?
See, Rohan, I think if you see the COVID pandemic, you can divide it into three stages basically, particularly in terms of innovation. Firstly was how to manage it, how to manage that pandemic, then how to diagnose it, and how to prevent it. So these were the three broad criteria. So we at the in our platform where the manager, myself and my colleagues and the leadership thought that we should look at from these three poles: how to manage, how to diagnose, how to prevent. So management also needed a lot of innovations. If you see last year when this pandemic broke, we were not self-sufficient in PPEs, thermal scanners, or this or oxygen sensors which we were in hand, then masks, sanitizers. So these were the things which need to matter. We really, and these are innovations which can be done, and ventilators, which could have been done very quickly. So we really created a platform to first look at these as the startups, Indian startups were really came forward very quickly and really supported. Now, if you see, we are self-sufficient in all these things and we are exporting also. So that was the first problem. Second is diagnostics. When somebody initially there was one lab, now you see there are 3,000. I don't have lost the count, plus labs who do it. So the diagnostic kits was a challenge. We used to import them. So we supported innovations in that place. And now you see all the diagnosis is being done in the Indian innovation platforms. So that was managed. Then comes prevention or treatment. You needed therapeutics, you needed drugs, you needed vaccines to prevent it. Then we concentrated on that. And right now you see India has one of the largest pool of vaccines which are going to come out slowly as and when their approval starts pouring in, as and when they do their submit the clinical data. So I think these were the three broad pools which were created to do that. And at an innovation platform which we all are working on is we targeted those. So there were some low-hanging fruits, say on management part of it, which we really funded fast, and some were a year-long say vaccines and things like that. So we all started together and started funding that platform. And now you see the results are coming out. So, and that is, but this is not that we funded and it came out. The innovation ecosystem in India, the startups, the mid-sized companies, the large companies, the government, the policymakers, the fund, all got together. All were together. We iterated our programs, we think, and we took it up from there. So I think that is, enabling ecosystem which we created, and then it moved it. So I think that was the strategy we followed, and it really took off. And still we are doing it.
That was a great perspective, sir. And a new one, because generally we commoners or say people don't know the perspective of the innovators and the approach they take to tackle certain situations. And you quite briefly but precisely pointed out in various points. So now moving ahead, this past couple of years, due to the arising need, we were compelled to innovate, to adapt to the change due to pandemic, due to which we got to see many innovations coming forward in various industries. So my question to you is, among all the innovations we observed in the past couple of years, would you like to highlight some innovations that you saw during those years that you find promising?
See, Rohan, I can't pinpoint particular innovation that it looked promising. They were all innovations. Being funding agency, one innovation to be promising. Every innovation was very important, starting from the low-cost ventilators to oxygen concentrators, which really brought out in an efficient way. The vaccines, which I think initial vaccine took 7-8 years to come out to the market. In 1 year, the vaccine was brought into the market by the Indian research community, the academics, the companies together. I think they very, 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 very crucial to see. So the vaccines come out in almost 1 year's time. So we started funding, say, around 1st of April or 15th of April, around that, and the first vaccine approval came in 1st of January. So I think and then there are a lot of medical devices and other things which really were brought out. So I can't pinpoint any innovation that this was the best innovation I could see which came out from all these things, because as if you ask your parent, and if you have 3 4 siblings, you can ask which is your best son or which, nobody will say to that. All funded innovations which we see have been, there are some failures also, but that's not bound to happen, because in innovation everything will not succeed, and that is the idea. We fund and we take risk in funding it, and that is we know, and that is also a learning, that this type of innovation, this type of science will not work. That's so be it. So we do that as well, and that is very interesting. So we will definitely carry that policy of a principle ahead to fund good innovations, and out of the bunch we fund, some may come out, some may not come out, but that is the risk we are taking, and that is what we are supposed to do. So I can't pinpoint any specific innovations, but I think all our portfolio of innovations, which have supported and which have not supported as well, have not come out as well, has given us some sort of learning. Each innovation is a learning. That is very important for us to take our journey ahead.
I agree with you, sir. And sorry if I riled you up with the question. As an innovator, this would quite feel a bit offending. So my apologies, sir.
No.
So now, further talking about innovations, I'd want you to share your work linked to your healthcare innovation.
See, my major portfolio of work is healthcare. Be it, my earlier Wellcome Trust as well, we funded almost 35 innovation in the healthcare space. And a lot of innovative projects came out, like the smart cane, the standing wheelchair, the polypharmacy approach for prevention of cardiovascular in the Wellcome Trust portfolio, and has been very, very impactful. And other innovations which were funded from that portfolio as well has really moved on to the next level, the eye care management systems and things like that, which has really created impact. It on the grand challenges model as well, we funded a lot of innovations which really have created impact, especially in the maternal and child health, which was really important innovation, which innovation is an important program. Everything is not innovation, but some things are way forward also. So that also, the maternal and child health, agriculture and nutrition, we had a lot of learnings there in the integrated farming, the solar conduction dryers, which really increased livelihood of the village folks, as well as nutritive foods, the integrated farming using increasing in the livelihoods. Then in antimicrobial resistance, we have worked on diagnostics, we have worked on surveillance method, data management systems, understanding data and how we can use it in policy making. So there are a lot of portfolios in healthcare, and healthcare is ever evolving. So I think there are many, many things which can be considered, but I think on the whole, all innovations, I say, is very, very important in healthcare, especially decision-making tools are important, which takes your thinking and moving and helps the policymakers to take decisions to innovate further and to pick up right innovations, right policies for our benefit of the human mankind and animal health also.
Now, after talking about healthcare industry and the innovations that it saw, we've observed great advancements in the healthcare industry through years in India, but there is always room for improvement. So what I would like to know is, what is the one thing, or say the advancement that you wish we could change, we could bring in Indian healthcare in future?
As I told you, it's miles to go before I sleep. That was, I think, Robert Frost. And we are still miles to go before we sleep. But if you see the last 10 years journey in healthcare, we have really improved a lot. There are a lot of things now. Healthcare is almost at the village level. The PHCs are very well. If you visit a PHC, they have computers, they have decision-making mechanisms. They can consult the senior doctors at the district hospitals and things. This was not there, and now things are changing rapidly. So, we have been, and these are how this has happened is because of the innovations we have brought in, the consultative mechanisms, telemedicine as approach, and it has showed that in our pandemic times a lot of consultation was done through telemedicine, and prescription used to come in, and so this is what has been changing, and innovation has played a very, very critical role in this. Similarly, there are a lot of still, a lot of innovations are being done, and there are a lot of gaps which is being addressed. And this is what the gap learning is also very important to see. We, last 1 year we started to use data for decision making, artificial intelligence. It needs to be used more aggressively for decision making mechanisms, so that the government is doing. Recently you must have heard that we are for this, celebrating the 75 years of the independence. BIRAC is going to come out with, the honorable minister also announced it, that BIRAC is going to come out with a program announced on data management, artificial intelligence, health decision making, to fund 75 programs which can be really used in India. So I think that is going to be announced, has been announced. So I think such type of innovative mechanisms which we will work on will really help us to take the innovations to the next level. But yes, there are gaps, and we are all, not only we are a funding organization, but the innovators are coming up to address those gaps. That is very important. And the innovation ecosystem has, earlier you will see that innovators used to be only at a higher level. Now student innovators are coming in place, which is very, very important, and it should be encouraged. People should not only think of getting jobs after doing their graduation, post graduations, or PhDs, but I think become innovators, creating startups. Government's policies have become so friendly now to create startups and become innovators, is that from student days you get fellowships, you get small funds to validate your innovation, develop a proof of concept, and take it to. So I think that community should also come up. Student community should be encouraged to become innovators and take their programs to the next level.
True, sir. This ecosystem was not quite being nourished properly in terms of community, say funding, or say government support. But now the times are changing, and we are seeing that people are being more and more aware about this ecosystem and are willing to contribute through this ecosystem. So I guess
funding is not a problem anymore. One, I think organizations
yeah, sir,
have created which are literally supporting young innovators to take innovations to the next level.
Exactly, sir. So now for my final question, I would like to ask, where can our listeners connect with you, sir?
So I'm available over LinkedIn. My email ID is on the websites. They can always be in touch with me. And through IC, I think, to Sanjay's office and things like that, they are always in touch. And I'm quite available. Not only me, my all colleagues in BIRAC are available to, help mentor young innovators to take their innovations to the next level. So I'm always accessible.
The link to connect with the guest speaker, Dr. Shirshendu Mukherjee, will be down in the description. Before concluding, I would like to thank Dr. Shirshendu Mukherjee for joining us and sharing your perspectives, sir. It was a pleasure having a conversation with you and an enriching experience, sir. Thank you, sir. To conclude, I would like to call out to our audience to leave a comment with a review and let us know whether you like the podcast. Drop down a comment if you have any podcast recommendations or any ideas. If you have a healthcare innovation journey of your own to be a part of our podcast, do connect with us. And for more such content on healthcare and innovation, visit innohealthmagazine.com. Stay safe. Goodbye from your host, Rohan Tandel from Inno Health Magazine Studio. Thank you.